Hello, welcome to the Cascadian. My name's Ethan. Let's get started. So today I want to do a video on the recent announcement of the University Health Network in Toronto to build social housing. This is going to go along with the Green New Deal playlist I'm going to make. So I wasn't actually about to do a social housing video quite yet, but this news just broke today, and so I thought, it's quite relevant. It's exactly what I'm talking about. So I might as well go ahead and do it. So if you haven't read the news I'm talking about, I'll have a link down below for you to go check it out. It's a quick Globe article. It's titled Toronto-based hospital network commits land to building affordable housing. The point that's really important about this is that they're building social housing with the explicit purpose of the housing being used as a form of healthcare. And this goes over a main point I made in the LEAP video, which is that, if we're going to do this, we have to do it all at once. And the reason for that is pretty clear. So I'll kind of go over a couple things here. So this land that they've committed to building is a parking lot currently, and they're going to consult with local housing and union, etc. groups to determine what's the best kind of housing we can put in here. Is it individuals? Is it 3-bedroom family apartments, etc.? So that's really important, is to build the right housing in the right communities. What I really want to go over is the most stunning part, where they decided to build this out of real world problems that they were dealing with. So this was a treatment to an illness, essentially. What they saw was that between 2018 and 19, 61 patients from Midwest Toronto visited the emergency departments at Toronto General or Toronto Western 20 times or more. So they accounted for basically 61 people went to the hospital 20 times within these stretches. And so they accounted for over 2,000 visits between 61 people. And so an average of 34 visits each, which is, crazy. And so the argument is that these people don't need to come to the ER, and they don't need an ambulance. They don't need this. What they really need is a social worker, a caretaker, a social worker to be around all the time, to visit maybe 2 or 3. I don't know the numbers, but we could have anywhere between 5 to 15 social workers for these 61 people that could live in these apartments, and instead of having to deal with all the expenses to do with housing them for that night and etc., it can just be there. And so what they are proposing is that the problem needs to be solved in a preventive and proactive way. We can't keep dealing with these people in the ER once they have an illness. So basically, as I put forward in the LEAP video, everything is linked. Everything is connected. For example, the social housing that this University Health Network is building is going to impact the rest of the city, because just for example, right? So the rest of the city is getting gentrified right now. It's an extremely gentrified area, and I live in one of the most gentrified cities in Canada, and I moved from the other one. So I know what's going on, and I'm looking at, last year I was looking at 1-bedroom apartments, for example, and they were $1,200. This year they're $1,700. And that's because all the affordable housing and all the family housing, all the 3-bedroom apartments, all the 3-bedroom units, etc., it's getting bought up and then demolished and then rebuilt as individual buildings, individual units for rich people. And we have enough rich people coming into Canada that it works for these people, but it isn't quite as efficient as it should be, but the prices are so high that it makes it worth it, right? Because a social housing unit, especially if it's built by the government, should only cost $500 a month max. Realistically, right? Like, housing used to be 10% of our income. It's about 40% now on average. So that's ridiculous. Let's say I make $3,000 a month and I'm paying $1,500 for rent every month, right? Then I have my food, then I have my transportation, my eating out, friends, etc., drugs. That is too much of my income. And so if I move to a social housing where I pay $500 a month, I'm freed up for an extra $1,000 a month. And suddenly I can go do things that I wanted to do. I can save that money away for retirement later. I can invest that money back into the economy. So instead of spending $1,000 a month on my rent, I can spend an extra little bit on healthier groceries, and I can work a little bit less hours, and I can spend more time on myself. I can maybe go to the spa, get a massage, or maybe I could enroll myself into interesting classes like on meditation or yoga at the park and do communal things. Or maybe I'm just so goddamn tired from capitalism, I just need a break for 3 months, and that's what it's going to afford me. Like I can get this leverage on my own life finally. For example, I'm not talking directly about myself. So homeless people and couch surfers could be put into social housing instead of having to go to the ER because they hear voices in their head, because they've stayed up all night because they can't have somewhere to stay, and they're sleep deprived and they aren't eating right, and so they hear these voices, for example, or they a list of things that could go wrong, and then they go to the ER. And then they're a burden to the system, and then they're wait lines, and then, etc. Just my girlfriend has been struggling with migraines, and we've had to go to the ER twice in the past couple months for it. And, the first time we went, we waited 12 hours for a room. 12 hours. I don't think it's the public system that gives us wait lines here in Canada. I think it's how we're administrated. But I also think it's to do with other things that we're not proactively dealing with. So we don't have any proactive healthcare. We don't have any preventative healthcare going on. And these things can be dealt with through, the NDP's platform. Pharmacare, dental care, mental health care is the most important out of all of those. Access to mental health care might not get you a job, and it might not get you an apartment, and it might not get you a girlfriend or a boyfriend or whatever, but it'll teach you how to do all these things that can add value to your life in a way that detracts the possibility of you having a treatable illness. You might think this is sounding very Marianne Williamson like, and that's because it is. You can have your quirks and caws about her campaign and everything else. I'm not a big supporter, but I do love a lot of what she does for various reasons, because I think she, Bernie could be the real one, right? The real progressive socialist that has the real platforms and has the real XYZ, this is what we're going to do. Williamson maps that to the people that don't really give a crap about, social welfare and social housing and, student debt relief and all these kind of practical programs. She maps that to how can we be happy as a society, and how can we live well, and how can we, use our wealth properly. And that is super, super, super important to understanding what's going on. So one thing she did is in the first Democratic primary debate, she brought up the idea that said, we don't have a health care system in the US, we have an illness care system. And we have the same thing in Canada, right? So instead of an illness care system, we can have things like communal yoga on Sundays. And I'm sure that already happens, and it already organically happens, right? But these things can be encouraged, and they can be sanctioned by the state, and they can be, given grants to do these things. And it can be taught in school, and there's so much more that could be going into this, is what I'm saying. Even though it does happen, it's not encouraged, it's not sanctioned, it's not organized in the way that would really make true impact. So, yeah, I think she's right in that. I think we need a healthcare system. And so, again, going back to what I was kind of saying, like, people have stressful lives, right? And so if we take away the burden of paying $1,000 less a month, and then we take away the burden of paying for pharmacare, and then we give them access to mental health care, and then they can get their wisdom teeth pulled out for free. All of those things are stressful. And all of that stress is going to lead in some way or the other to an illness that has to be dealt with at the hospital. And so and that's expensive. The dealing with things at the hospital is very expensive compared to, a Sunday yoga class or a talk with a mental health counselor. Additionally, this is quite symbolic. There's more to health and living healthy than illness care. It's a hospital saying, we have an actual need right now in front of us for rooms that are dedicated to people. So we need social housing on the hospital grounds with social workers inside working with these 61 individuals we've already identified, and we can probably triple that number if we wanted to, if we really looked into it. And that's really important. So many people can say this is vague, or these problems are vague and we don't know what to do and blah blah blah, but the hospital itself has real world incentives to do this, right? And it's kind of capitalistic, and I hate that, but it's also good because this is good stuff being done. And yeah, I just woke up to this news today and I wanted to get out a video quick about it. It's very important and it's very exciting for everyone involved. So social housing is top tier on my list. I think it's utterly important to having a good society. And, I think normalizing it through things like healthcare and the hospital actually needing it is hyper important to implementing this across the country, because as Jagmeet Singh has said, all the way from the shores of Victoria to the shores of New Brunswick and the Maritimes, everyone is experiencing housing crises, and everyone has high rent, and everyone is getting gentrified, and it's stressful, and that stress is going to lead to further problems, which is going to be more expensive. Like, there's always the argument that the dollar you spend on early childhood care is like $3 less than what you're going to spend in like prison funding or law enforcement, or dealing with the problems that come up if someone doesn't get early childhood care, for example. Yeah, that's all I wanted to say. Thanks for tuning in. Talk to you soon.